Bushey Meads. Hope you're having a good science week. My name is Hannah and I'm an advanced clinical specialist podiatrist working in the northwest of England.
What A-levels did you take? If I wanted to do podiatry, what A-level should I take?
So I did biology, chemistry and psychology all the way through to my A2 levels, and I did a maths AS level. I'd recommend doing a science of some description, preferably two, and then whichever other subject you are interested in.
What is one cool thing that you've seen in your career to date?
So, as a podiatrist, you see lots of cool things every day. I'd probably say the coolest thing I've ever seen is maggots in somebody's leg wound. They weren't supposed to be there. We do have some treatments where we intentionally use maggots to clear up things like dead skin, but these maggots weren't supposed to be there. And we think that they'd got in from a fly getting in there in between a dressing change out in the community. But yeah, I was quite surprised when I took off this gentleman's bandages and maggots fell all over the floor. You've got to have quite a strong stomach for this career as well.
Could you describe one moment where you felt you made a difference?
So again, you make a difference to people's lives every day working in healthcare, no matter which career you choose. But one moment that stands out for me was when I was routinely checking the pulses in one of my patients' feet. We use a machine called a Doppler, and it allows us to listen to the regularity and the noise of the heartbeat sort of getting all the way down in the vessels into the feet. We found that this patient had got an irregular heart rhythm, so he was referred back on to his GP, which then referred him on for further tests and found that he had a condition called atrial fibrillation. He was put on lifelong medication to prevent him having a stroke. So yeah, that was a good moment to sort of reflect on in my career and to see what a big difference you can make as a podiatrist.
What would you want to be if you were not a podiatrist?
So I originally wanted to be a vet, but I think I fulfilled that aspect of my life with all of the animals I've got now as pets.
What does a podiatrist do daily?
So it depends what type of podiatrist you go into. Very similar to Tommy's specialties, podiatry can have lots of different avenues as well. For me personally, I have chosen to specialise in biomechanics, which is looking at the soft tissue such as tendons, muscles and ligaments, and bones of people's lower limb. So my day-to-day is seeing lots of patients that might have got sports injuries or elderly people that are becoming more frail and therefore they have pain in their legs or feet, or children that are having problems with their normal development. So yeah, clinics are a big part of my day, and I do a little bit of management. So I've got a team of 6 other podiatrists that I check in regularly with and support them in any way I can professionally.
What inspired you to take podiatry?
So I chose podiatry mainly to help people. It's a career that gives you a lot of autonomy from the very beginning of your career, and you can have a very good work-life balance as well, which is a big plus point in healthcare. I think not many careers will still allow you that, but podiatry does.
Has coronavirus impacted your job in any way?
Yes, so at the start of lockdown, all of our non-urgent treatments had to stop. So we had to go through a huge number of cancellations, and we had to personally contact thousands of patients to let them know what we're doing to still support them, but from more of a remote type setting. However, our normal workload for things like wound care and limb salvage had to continue to reduce the number of admissions into our acute hospital. But yeah, fingers crossed we won't have to work like that for much longer.
What extracurricular activities do universities look for?
So this is probably similar to medicine. Anything sporty or shows that you can work well within a team, or that you have commitment or a passion towards any hobby that you might have. They're all skills that are useful in a job working within a healthcare setting. So anything like that.
What do you say when they ask you what hobbies you have in an interview?
So my hobbies were more sports based, so I've always played netball. I use that as an example to show how I work well within a team and how I'm dedicated and committed to going to weekly training sessions and playing the matches every week. But yeah, so picking out the key points again, whichever hobby you've got, and trying to apply them to the practical side of the degree that you choose.
What is the difference between podiatry and chiropody?
So this is a question I get asked most days. There is no difference, but you can't study to be a chiropodist anymore. You will only do a degree in podiatry. It's sort of replaced that old-fashioned title, but you will still see certain qualified podiatrists calling themselves a chiropodist as well.
Our theme of the week is innovation. Could you describe some innovations in podiatry?
So probably the biggest innovation is how we look at how people walk and run. So that area of podiatry is called gait analysis. Technology is constantly advancing in this area, and I suppose a practical application of this is seen in the Paralympics with all of the advanced prosthetics that we have now, with people using blades in the running discipline. All of that wouldn't have been possible if it wasn't for the advanced 3D gait analysis machines that we use in practice.
How long is a university course in podiatry?
So your undergraduate course will be 3 years in England, 4 years in Scotland, and most podiatrists will go on to do some form of masters afterwards to specialise further, and that can take anywhere from 2 to 5 years to complete.